Hello, everyone. I'm Kath McRoby. I'm from Quote This Woman Plus, and today I'm chatting to Atiya Mosam. And the reason why I'm talking to Atiya is because Atiya started a very interesting program that profiles people who are starting careers or who have developed careers in public health. And it made sense that one of the first people that Atiya would profile is herself. So today I'm doing Atiya and asking Atiya's questions for her. But Atiya, let me start by doing an introduction of you to our audience, and then we will start asking questions. So Atiya is a public health medicine specialist who's had nearly 20 years experience in the medical field, and 15 years of that has been in public health. She's got her own independent consulting field, working on both global and local health systems, both in terms of policy development, policy implementation, as well as working on global and local health systems. Atiya, before I start asking you about your own public health journey, perhaps let's just start with why. Why did you decide that these interviews were a good thing to do? What are you trying to achieve with them? And who do you think will be watching them?
Thanks, Kathy. So this initiative really was born out of the fact that, firstly, public health, I think, like many careers, doesn't have a strict linear path. And there are many ways that you can study public health. There are many different aspects of public health that you can get involved in, many different levels of the health system that you could work at. And in recent years, I think, especially post-COVID, public health has really come to the fore as a field within medicine and in health that provides a lot of value to populations. And many more people are seeing it as a viable and interesting career choice. Now, with that comes a lot of questions, and I have a lot of, especially, junior health professionals or emerging professionals who have a lot of questions on how did you get into public health? What do I need to study? And I thought, it may be easier we set up some sort of forum where they can get this information. So we've started with a few webinars where training institutions can get together and kind of give the ABC of how you apply, what you need to know, how do you think about a career in public health. But that's just one aspect of it. And then there's the aspect around the actual career and how do you go about making the choices and what steps do you need to take or how do you navigate different spaces. And I thought it may be useful for people to actually hear firsthand from people within the public health field what their career journey has looked like, what were some of the considerations that they needed to take into account when they were making career decisions. Where are they now? What is it like working in the spaces that they're working in? And so, so that's where these sort of individual conversations come in. And I'm hoping to profile a range of public health practitioners, not just medical specialists in public health, but people who have pursued other avenues into public health and may not necessarily also have a medical degree behind them. And I'm hoping that this will give people who are interested in the field some insight into what it is like to pursue public health as a career.
Atiya, that all sounds amazing. And I think it's amazing that you're doing this. And I think more people should be doing this in more fields. And let's just dive straight in then and talk about you and your journey. So what made you decide that you were going to go into public health as opposed to clinical health? Or maybe it's not a boundary, maybe it's not something. Tell me, I'd love to know.
Thanks, Kath. I think, as you say, it wasn't so much an either or, but it did start off with me realizing quite early on in my career that maybe clinical medicine wasn't for me. So as I did my final years of studying, as I did internship, I realized that I liked, medicine enough or the different specialties enough, but not enough for me to actually want to go into any of them for the rest of my life. So that was one of the, first realizations. The next was, and I see this now in hindsight, colleagues used to comment, especially my internship years, about how I should go into management because I was always looking for, more efficient ways to see patients or better ways of arranging things in the ward. And, I think those little nuggets embedded in my brain and sparked in me that, oh, maybe there is a different career path for me. And then the third was really two instances where I think my sort of social solidarity and conscious was sparked by, firstly, the xenophobic attacks that happened, I think, in the late 2000s, where I then got involved with MSF and Gift of the Givers to, volunteer medical assistance or, food parcels or food collection for those who were displaced by the attacks. And then the second of this was, I actually pictured this in my mind. I was walking around a ward the one day and I happened upon a lady who was standing next to a school-going child and doing sums with him. So I was quite curious. I said to her, I was like, sorry, please tell me what you're doing. And she said, no, I'm a teacher from the school that's on the grounds of the hospital. And we come in and teach kids who whose schooling may be impacted because they're in hospital for a long time. And it didn't strike me at, all those years, you kind of learn about social determinants and how, health, there's other factors that are responsible for your health. And it didn't strike me until I saw that a child getting education, that your education can affect your health, but your health can also affect your education. And so that's, I think, when I started thinking about, are there ways that I can contribute to medicine or to health in less of a one-on-one patient interaction, but more on a population level. And that really then spurred me to thinking more about public health as a potential career choice.
Wow, sure, that's really interesting. And I mean, it's interesting for me as a non-health person, and I'm sure it's going to be equally fascinating for people who are in health, either in the clinical or deciding to move from clinical to public health. So that was then, and how did you go from that point, making that decision, to where you are now, running your own independent consultancy business? What was that path?
So interestingly, I think that was a mixture of luck or circumstance, and decisions that I then ultimately have to make. So the first sort of circumstance was thanks to the administrative powers that be, my forms that I had filled in for my community service placement were lost somewhere. So what that means for anyone who's had to do community service is, if you're not placed, it's very difficult to move around if you're placed somewhere because of, it's allocated on need. But because mine were lost, that means they hadn't placed me anywhere, which means I didn't have a job, which means I could find my own job. And so, yeah, it was fortuitous for me. And somewhere in, the back of my mind, I remembered one of a professor who had lectured us, but had also done some of our assessments during internship. And he was a professor of family medicine. And something made me reach out to him to say, do you have a job at the time in Soweto at the clinics? I really love Soweto and I really wanted to continue to work in Soweto, but I didn't want to work in Barra, even though that was an option. And so, so he, because there were, positions available, he was able to take me on as a community service doctor. And I had said to him also something along the lines of, like, I'm interested, I don't know if I said research or management, something. I actually should go and see if I can find that email. But so he took me on, and I always say to people, my journey in public health actually started in family medicine, because even though, his name is, actually should mention him, his name is Professor Shabir Musa. Even though he is a family physician, he has a very public health lens about the way he does things. So I started doing a lot of clinical management work, research as a junior doctor. So I was really lucky in that way. And then I applied to do my specialization in public health. I didn't get the post, for probably a few reasons, not being experienced enough. I was late for the interview because I was stuck in traffic. So who knows? These are the things that, you don't know. But anyways, all of this come together. I didn't get the post. But a year or so.
I have to just interrupt you there and say that's probably going to be so reassuring for so many young people when they see where you are now and find out that you just get your first application, because life goes that way, doesn't it?
And to be honest, when I was thinking about it earlier, I was like, what was my plan back then after I didn't get the post? And I don't think I had a plan. I kind of just was like, okay. And I was enjoying what I was doing. So I was like, well, whatever. Then it just so happened, because I was doing a lot of like I said, I was having fun. So I was doing all of these social solidarity activities, like fundraisers, etc. And because of that, someone nominated me for a leadership program that is run by an organization called Common Purpose, which now I'm actually on the board on. I was doing the Navigator program, and they had an alumni event. And at this time, the Gautrain was new, so it was all fun and fascinating to take the train. So the alumni event was in Pretoria, and everyone jumped on the Gautrain and went off to Pretoria. And I happened to be sitting next to a lady who told me that she was the CEO of Helen Joseph. So we started chatting, and I was telling her I didn't want to do public health. And then she said to me, did you know you could do a master's in public health? Because she was doing a master's in public health at the time. And I did not know that. I don't know why I didn't know that, but I didn't. And so that spurred me then.
So what did you apply for if it wasn't?
I had applied for the specialization in public health.
Oh, I
which
see.
is for medical doctors only, the same way you would specialize in pediatrics or orthopedics. The master's in public health is a university-run degree that is open to anyone with an interest in public health. And you don't need to have medical.
You don't have to be a medical doctor to do that. Okay.
Yes. So that's another way of getting into public health. So based on that, I went and I applied, and I got into the Masters in Public Health at Wits, and I did my 4 years. And I quite distinctly remember one of my then lecturers, now a colleague, said to me one day as I was passing her office, she said, you really should go and still apply for the registrar post. And for various reasons, salary, the type of work, etc. And so initially I was quite resistant. I was like, but I've done the master's, I've already applied. But then, after seeing that, okay, it actually was quite difficult to get a job just with my master's in public health, I then applied for the registrar program, and then I got into the specialization to study further. What is really interesting is this. The colleague who advised me to go do the specialization, she's also a specialist. So she then ended up being my first supervisor when I started training. And so her name is Dr. Roxana Gina. And so she took me on because the way that specializations work is you are allocated to a hospital which pays your salary. So she took me to meet CEO, and the CEO was the same lady.
From the train?
Yeah, the train, exactly.
Amazing. Wow.
And she said, this is Miss Gladys Bogoshi. She said to me, she's like, sorry, I get emotional when I speak about this. And she's like, I know you. And I was like, yeah, you gave me
amazing. Wow, I'm getting goosebumps. This is freaking crazy.
So
wow.
I should have got a tissue. But yeah, so that's basically how, as I say, it was, sort of decisions and circumstance that led me here. And then I did,
So you've got your master's in public health, and you've got your specialization. public health. So I'm interrupting you, but how common is that to have both?
There's quite a few people that do that. Some people either do it because they find it difficult. There's very few specialty posts to go into the training program in the country. I think, if I'm not mistaken, we probably have around 30 in the entire country, which is far less than any of the other specialties. So some people then go into or do a master's as a way to try and get into the specialization. So it is quite common to have people. Also, I think some of the universities do try and take, people who have experience in public health. So it is a way of getting some of that knowledge under your belt. Yeah, so it is quite common, but that's not to say that they aren't. I just want to put out there that you have to have an MPH to get into the specialization.
Yeah, or vice versa, that you have to be a medical doctor with a specialization in order to develop a career.
Exactly.
Yes. Yeah. Wow, that's amazing, and that's really, really interesting. It's a very interesting insight, as much for me as a non-health person as I'm sure it will be for health people who are going into the or deciding whether they will go into the public health field. So what is your role now?
And when I finished my specialization, what I think it really helped me to do was think about which areas in public health I didn't want to go in. Similar to clinical medicine, when I finished it, I knew kind of which parts I wasn't interested in. So that's always easier than knowing where you are interested. And even though I started my public health journey thinking I wanted to go into hospital management, because as a Barra intern, I thought, I can do this better if I just had the qualification. But I came out of my specialization realizing I actually didn't want to go into hospital management. It wasn't for me. And I thought academia. So I was fortunate enough to get a position in an academic research unit, Priceless, which is at WITS, and it's a health economics and priority setting unit. And that also worked out that I only had a 3-day or half-time job there. So I was able to then pursue consulting on the side, and allowed me then to think through my career in that way. So I spent 2.5 years at Priceless, really enjoyable projects that I was on, but then again, helped me hone the fact that I'm not someone who's not that I'm not interested, but not geared for long-term academic projects. And I prefer sort of shorter-term projects. And so then I took the leap into full-time consultancy, and have been just fortunate enough to be able to work, as I said, in both the local spaces, so all the way from, working with a district to develop interventions for a district, to the National Department of Health, helping develop policy, to global institutions who are looking at ways to standardize information gathering. So really interesting mix. It really pulls on the different parts of my public health knowledge, even though I work a lot in mostly in policy and implementation of policy and how to strengthen the health system. So it's been a journey of ups and downs. And it may sound, I just want to say to whoever is watching this, it may sound like it was a cohesive story and it all just come together. But I read something the other day that says we can only connect the dots looking back. And so it may look like it's all connected, but it does take many years for it to converge to this point.
Sure. And how many years have you been consulting full-time for?
Full-time since mid-2021. Yeah, so it's about 3 years now.
Okay, awesome. That's wonderful. So I guess, Atiya, the most important question is what advice you have, if for people who are looking to pursue a career in public health, or even just thinking about it as one potential option, what would you say to them and what advice would you offer?
So I think my first piece of advice is, and it's going to sound counterintuitive, but the first thing is to think about your life holistically, but you plan only for 5 years. Now, what I mean about that is that when you're making decisions, it's helpful to think about where you want to be in your entire life. So what do you envision your relationships to look like? What do you want your spare time to look like? How healthy do you want to be? How do you want to contribute to society? Because all of this impacts how you choose your career. You have to be able to understand what you're willing to give or take in order to pursue different things. And so if you want to pursue a career that you know is going to be very demanding, you need to be aware of how that may impact your health, your ability to exercise, your relationships, etc. So think about all of those things when you're making a career decision. But don't be stressed about thinking about where you want to be. I know it's tempting. Sometimes we see, oh, we want to be the head of the WHO. That is, 20, 30 years away. Think about 5 years. Think about in the next 5 years, where do I see myself, what I want to do. You can't plan for 20, 30 years time. You can have a beacon. There's no harm in that, but you can only really plan. And if you think about it, this is actually a piece of advice that I found in another book. And if you think about it, they say we live our lives in 5-year periods. If you think about primary school and then high school is another 5 years, and then we go and study, it's about 4 to 5 years. So really don't attempt to try and design everything. Just think about what for the next 5 years. It's a long enough period for you to be able to make some concrete plans. So that's the first thing that I would advise people to do. The second is to try and find a mentor. And there's 2 types of mentors that I would advise. The one is obviously a senior mentor, someone whose career you are either looking to emulate, or someone who you find has good insights, and you would maybe want to draw on them. And I'm actually going to put out a piece soon around some of my thoughts around mentorship, how I've managed to think that through, and what are some of the things to look out for. But it's very important to try and get someone. Like I said, I've had some very good mentors, like Professor Shabir, who may not at the time have articulated that I'm mentoring you, but did a lot of that mentoring. Some of the colleagues that I've met along the way, and now recently, some people who are colleagues, maybe a few years more experienced than me, but friends as well, that offer advice or insights when needed. And similarly to a senior mentor, peer mentors, so people who are maybe just around where you are in your career, maybe similar ages, similar life circumstances, that can also just help you muddle through some of the things that you're grappling with. It's so important because sometimes you need people who are sort of at your level, who can understand. People who are senior to you may have forgotten what it is like to be grappling with some of these issues. So that's the second piece of advice. And the third, I think, I don't know that this is specific to public health, but in general, just to find a way to contribute to society. All of the really interesting opportunities that I've gotten is because of contributing to things that may not pay me or do not benefit me directly. So like I said, I ended up on the leadership program because I was volunteering. I ended up getting opportunities because I served on the Public Health Association of South Africa's executive committee. Again, it's not a paid position. You really are a working board. And I think sometimes people feel that like you can sign up for these boards or institutions, but just kind of be there. You actually have to get involved. You have to do the work and meet people, and it really will bring about such interesting opportunities in your life. I mean, you're probably going to hate me saying this, but I even met my husband through a volunteering activity.
That's awesome. That's so awesome.
So,
Wow.
so yeah, so I would say to
Mm.
people, volunteer. It will, if nothing else, you will feel good
Well
at the end of
enough.
it.
Sorry, I shouldn't have said.
But yeah, like I was saying, if nothing else, you'll feel that you've contributed to society. And on the other end of the spectrum, amazing things may happen for you because, you've contributed positively to this world.
And I mean, I just have to build on that, on one tiny point, and that is, as our world becomes more complex and more interconnected and more difficult to understand, the more we do that, the better we just vaguely start to unravel it and understand it. So I totally endorse that. And I have to say that every single one of those points I just love, because I think they're applicable for any career as much as for public health. So I hope you're going to put them out there for everyone to be able to share. Yeah. Anything else that comes to mind? Any final points that you think need to be made for a young audience thinking about public health as a possible career in South Africa?
I think the one thing that I would say is that public health can be very fulfilling. But a lot of people may get into the sort of trap of thinking that you're going to see change immediately. And it's very different from clinical medicine, where you see someone get better or you see some sort of change. Someone either gets better or they don't get better. Public health is a long time. The health system takes a long time to get better. And the health system is our patient, basically. That's who we're working at. And so it sometimes feel disheartening, feel like things are taking too long, but you really have to be in it for the long game, because changing minds, changing the way things are done does take a long time. So if you are drawn to sort of immediate results, just know that public health may not necessarily always. I mean, there's definitely ways that you can bridge that gap. There are parts within public health, people do, it may not necessarily be strictly public health or strictly clinical, but some people work in like clinical research where you can see immediate effects, or you understand whether a drug is working or not working. You can, but a lot of like the policy work, etc., does take a long time, and so you really have to have the ability to hold on till you see the impact, or know that you're making a contribution, even though you may not see it immediately.
I think that's a great point, and a very important point. System change is very different from short-term impact.
Yeah.
Awesome. Thanks, Atiya. That's been a really interesting interview, and I wish you every strength for the rest of your career and for this program. I'm looking forward to watching the other interviews as well.
Thank you, Kathy. Thanks for taking the time to do this initial intro. As you say, I'm really hoping that this provides value to anyone, not just my interview, but all of the ones that are to come. And I hope that it is a repository for a long time for anyone. I know times change, but some things do stay the same. So hopefully, it is a useful repository for anyone looking further into public health.
Awesome. Thanks a lot.